So good afternoon, everyone. Welcome to our final and best for the last session, talking on ethical dilemmas and moral challenges of choosing to report elder abuse. So I'm pleased today to be joined by Rosanna Mercy, who is a bioethicist, and she's a intergenerational mediator, a practicing healthcare ethicist, and has a business called Compassionate Consultant. So she's going to share her expertise with us today on some of these dilemmas that we often, I think, encounter when we're dealing with seniors who are at risk or experiencing abuse. Just to give you a little background on Rosanna, she has over a decade of experience as a practicing healthcare ethicist and has been in healthcare since 2003. She has mediated countless value-based conflicts amongst patients, clients, residents, families, and healthcare professionals, keeping the client's values at the center of care. Over the years, Rosanna has developed a passion for helping older adults maintain personhood and autonomy throughout the aging process. Through her experience, she's offered families the hope of resolving challenging situations in a ways that nurtures and maintains relationships. She's completed her Master's of Health Sciences and Bioethics from the University of Toronto, Joint Center of Bioethics, and she also has an academic fellowship in clinical organizational ethics with a JCB, and was a senior ethicist fellow at Toronto East General Hospital. She's accredited certificate in conflict management and mediation. And she holds a qualified mediator designation as an accredited intergenerational mediator with the Ontario Association for Family Mediation. And she also co-chairs the Elder Mediation Special Interest Section for the Alternative Dispute Resolution of Ontario. And proudly, in 2022, last year, she received the Canadian Health Executive Designation from the Canadian College of Health Leaders and a Master's Certificate in Health Leadership Development from the Schulis Executive Education Center at York University. Wow. So we are in the hands of an esteemed speaker, an expert in this issue. I'm so pleased that you're able to join us today, Roseanne, and share what knowledge you have to help us sort of deal with some of these dilemmas that we often encounter when we're supporting older adults. So I'm going to turn it over to you to provide your presentation. And just a reminder to everyone, please put your questions in the Q&A box, and please engage in conversations in the chat box. We do have some polling questions that will hope to engage you in this conversation today. Thank you.
Great. Okay, great. Thank you so much. And thank you for the introduction and this opportunity to talk with all of you today. I think Denise shared, we get overeducated, but it's really how we work with individuals and people that's really important. And so that's what I'll be sharing today with all of you, my experience over the past 20 years working in healthcare, but also experience of working as an intergenerational mediator and helping older adults and their growing children work through challenging situations. And what we'll really concentrate on are ethical dilemmas and moral challenges of choosing whether or not to report elder abuse or suspected elder abuse. So as we've heard in some of the presentations today, there are some instances that are quite clear of whether or not to report elder abuse. And for this presentation, what I'll ask all of you to do is kind of turn your minds to cases that are a little more unclear. And I'll provide kind of a high-level overview of some of the ethics principles associated with reporting elder abuse, and consider benefits and harms of reporting cases that are in that gray zone. So we're really going to focus on those gray zone situations. I'll also introduce one tool. There are many ethical decision-making tools, but one tool that may be helpful for you in your practice. And we'll also explore opportunities where there may be misunderstandings or voiced or unvoiced needs that are not being met, and how we may be able to negotiate those situations and challenging conversations through values-based mediation. And finally, I'll introduce comprehensive aging plans as an upstream approach to work toward mitigating instances of elder abuse as well. I thought we'd start with a couple of cases, and this is the case of Anne. And Anne is an 86-year-old woman. She has arrived at the hospital by ambulance. Her friend Sam meets her in the emergency department. She's delirious and shouting, and Sam is stealing everything from her. And she is demanding that Sam be removed from the emergency department. Sam is approximately 20 years Anne's junior. He shares that he is Anne's good friend. They've known each other for a few years, and he helps her with her activities of daily living. He also shares that, Anne has had a fever for a few days, and when visiting her today, she was screaming at him, and that's not her normal behavior, so he got worried and called an ambulance. So the team asks Sam to leave so that Anne can settle because his presence is causing her a lot of distress. And 2 days later, Anne is more settled, but she's still expressing concerns of financial abuse. The team thinks Anne will be ready for discharge soon, and they're unsure of what to do next. Okay. So this is that, gut reaction that is very important that Denise Coster mentioned in the morning, the keynote address. And it is important to think about. So the team is paused at this point, right? And they're unsure what to do. So this is a great opportunity to explore it further. What I thought I'd do here, just to engage you, I know it's the end of the day, you've watched lots of presentations. So I'd like to engage those who are on with us to think about what you would do. So what do you think the team should do? Should they report this at this point as alleged financial abuse or not? And as you enter your choice, either yes or no, into the chat, I'd like you to consider why you're saying what you're saying. So if you're saying yes, why yes? And if you're saying no, why no? And maybe in the chat box, you can enter some of that context as well. So the thoughts behind your yes or no response would be great as well in the chat box. And we can potentially, maybe Rayanne can help with sharing some of those if you've entered some feedback in the chat. And I will also try to keep an eye on that as well.
So we just have, we have just about a quarter of the people are still voting.
Okay, great.
For the session, so we'll just give it a couple more minutes.
We'll give it a few more seconds just for you to think about yes or no, your first impression of this case. I know you don't have a lot of information. That might be some of what you enter in the chat. But just your initial reaction, yes or no, would you report at this point?
So I'll just end the poll. We're about almost all the people, so I'll just end it. So there's the other one says choice 1 or 2. Basically, it looks like most of the people, 74% are saying yes, they would report that.
Okay, interesting. And I'd love to know, and might not be now, we're going to have time at the end for Q&A and comments, and so you may want to share some of that then as well. But I'd love to know why you said yes or why you said no. I think that's very important. So just thinking about this, I'll share a little bit more about the case now. So we see that most of you said yes. And what I'll share is that as discharge was being explored, the team actually found a nephew, so Anne's nephew, that they could reach out to. So that's why they continued. This gut reaction was so important for them to stop and consider what other options did they have. So they did find a nephew. And he confirmed that Sam is a very helpful friend to Anne. They also shared that Anne has accused other members of the family, actually kind of the entire family, of stealing her money when she is unwell. And the nephew also shared that he is the attorney for finance, and he hasn't seen anything untoward happen with her finances. And actually, a few days later, so Anne, the medical team shared that Anne had a UTI, and as her delirium subsided, Anne, when she was more lucid, she actually denied all instances of financial abuse, and she was unaware why she would say something like that. So really interesting. So our knee-jerk reaction may be to report or not report, but also it's a good opportunity to stop and think, what should we be doing in this case? And do we need more information?
Rosie, just before you go on, somebody just wrote in the question box, which is important. So like, who would they report to? Social worker in hospital? Like, is in terms of that? And I know that this is hypothetical, but just thought I would bring that forward.
Yeah, that's great. So this team, if we're thinking about a team that has a case like this, it's not, these are kind of compilation cases based on a few cases. So a team in a hospital definitely would reach out to individuals. So they could reach out to social work for sure, would be a really helpful resource. They could reach out to their practicing healthcare ethicist to be part of this decision-making, to unpack the case a little bit further. If they felt that it was necessary, they may want to report out of the hospital. And we also have a legal department. We have lots of people, a risk department. So lots of people involved that could help support decision-making of this team in hospital. In community, could be very different, right? So I've also had experience with clients in communities. And so that was a hospital scenario. And now what I'm going to provide is a community scenario to consider. It's a great question. So Dave is a 75-year-old gentleman. He was diagnosed with ALS 2 years ago. He was discharged from hospital about 4 months ago for palliative care. His wife is his primary caregiver, but they have a long history of mutual physical and emotional abuse. The physiotherapist and the home and community care support care coordinator feel that Dave's wife is neglecting him. The physiotherapist often finds him unclean, undernourished, and with bruises on his arms. He insists on staying home, even though he's not receiving the care he needs. Mind you, he hasn't said he's not receiving the care he needs, so just to keep that in mind as well. He has implied that if he leaves the home, his wife will win and will have control over his possessions. 1 month ago, Dave's health declined. He can no longer phone to get help if needed. His wife seems to be increasingly agitated, and the physiotherapist is the only person Dave's wife will let in, and she works hard to maintain their relationship. Both the physiotherapist and the care coordinator don't know how they can protect Dave and still respect his decisions. So think about this case. We're actually going to unpack it using that idea tool that I mentioned earlier. And what I want to start with is just to think about what an ethics issue is, right? When we think about elder abuse and reporting, what are those gray zones and what's an ethics issue? So some ways of defining an ethics issue are when we encounter conflicting values, beliefs, goals, or difficult alternatives. So for instance, in the case of Dave, he really values being in the home and his autonomous decision to stay. The healthcare team working with him may value his safety more. And so there's a conflict in those values, and we're trying to bring those closer together. Right. Another definition may be where we're concerned about rights, fairness, and justice. And I think we've been talking about that all day with elder abuse situations. The middle one there, where we're unsure of what we should do or why we should do it, doesn't necessarily mean it's an ethics issue, but it's a good opportunity to stop and think and unpack a little further. What is this and what are we dealing with? Where there's conflicting obligations or responsibilities, right? So we want to think about those conflicting obligations or responsibilities. I had one case a few years back where our patient was the one that we were concerned may be abusive towards his loved one if returned home. So thinking about that obligation to the patient, but also then feeling this responsibility to ensure we don't put a loved one into an abusive situation. So really complex. And sometimes in this last one, thinking you know the right thing to do but cannot do it is the definition of moral distress. And sometimes we feel that moral distress, and how do we work through that as well? So when we think of why this is all relevant, right, the law will tell us what we can and cannot do, but in these gray zones, right, we're really thinking about what are the ethical principles underlying medical moral choices, as well as the relationships between all these individuals, between the caregivers, the older adults, they may be our patients or residents. And thinking about these, that each person does see the situation differently depending on their perspective. So we all see things from a different perspective or position, depends on our culture and our experience and many other things, but we all have this shared goal, right? I think the older adult themselves and also those around them want to ensure we have quality care for the individual. So that's also really important to consider, of course. And we know that clinical skills alone are not always enough to provide that ethically and culturally sensitive care for reasons I've already kind of gone through very quickly. And medicine and its practice are not value neutral, right? There's certain things that are more clear in medicine that if if we have an infection, we may want to administer antibiotics if it seems medically appropriate. But then there's other parts that are not as clear. And so we want to consider what the values of the individual are that we're caring for and how we can support them. We also know that there is a strong correlation between how we express our own value systems and beliefs and how we communicate that, and the individual patient, resident, older adult, client, their outcomes, and the function of the team as a whole. And we know that these unresolved ethical challenges can cause moral distress for all involved, right? So when we're thinking about these ethical challenges, should or shouldn't we report, right? We're left with that moral distress on, are we doing the right thing for this individual? And we want to consider that too. So just thinking of some of these ethical challenges and principles associated with reporting. So things that we may want to consider that we try to maybe balance, or after unpacking, realizing that some principles or values will outweigh others, and then how do we proceed when that's the case? So some of these include informed decision making. So we all know that we want to presume that a person is capable. We want to presume that the older adult is capable until we have reason to believe otherwise. So we go in presuming capacity. But when we think about informed decision-making, does the older adult know all the things that could be available to support them, right? So considering those pieces, do they have the ability to understand the information that you're providing them that's relevant to the decision that you're asking them to make? And do they have that ability to appreciate the reasonable, foreseeable consequences of their decision or their lack of decision? Also considering, when we're thinking about a decision being voluntary, who's in the room while this decision is being made, right? So is it somebody that maybe the individual in front of you, the older adult, doesn't feel that they can actually share their concerns or fears or worries, right? So considering who's in the room and how and where the conversation is happening is really important, right? And that all goes towards respecting the person's autonomous decision making. So allowing them to determine for themselves what the right decision is. And so if we think back of the case of Dave, right, over a lifetime, there's so many factors to consider. And so Dave is saying he wants to stay in the house, even though there's some reason to suspect that maybe there's some neglect or abuse happening. Right, we also want to make sure we're balancing safety, right, the safety of the individual. But when we think about safety, we want to definitely avoid injury. We want to reduce risk of harm. We also want to consider the potential harm that if we don't have this right, Could this harm the relationship between the older adult and the person that is being accused of abuse? So considering that as well, and that's why gathering information is so important, right? And then we also, of course, as we're sharing, when we think about non-maleficence, is avoiding that harm. Overall, we really, I think everyone involved with older adults and the care of older adults and thinking of potential abuse, we want to ensure that we're supporting their welfare, right? And maximizing the good and promoting their well-being. Well, also, they have rights, right? We want to support the rights of the individual. And definitely, if there is abuse happening, we want to ensure that we are reporting that abuse. But we also want to maintain their confidentiality, right? So in order to disclose information, we want to check with a capable older adult on whether or not we have the authority to do so. And this all supports their overall dignity, right? We want to make sure that we're treating them in a way that feels dignified to them. So when we think about these gray zones and reporting abuse, we want to consider all of this in making these ethical decisions. And that's really a critical reflection on what are the ethics issues involved, deciding what we should do, what's right or acceptable in this case. And each case will be quite unique. We want to explain why we're doing what we're doing. So justifying our decisions in using ethics principles, the values of the individual at the center of the care, and then describing how we should do it. So the method or manner to proceed, and the how is really important, right? So that's, we want to consider that. And then, if you're working in community or in hospital or individually, if you have a team of people, and that's where, more voices can be helpful, if appropriate, if they're part of the circle of care, then we want to engage those individuals so that we can come up with the least harmful solution to the older adult. Really, they're the ones we're concerned about at the center of care. And that's where these ethical decision-making tools can be incredibly helpful in these gray zones, right? They can facilitate these open and non-threatening discussions, because there can be a lot of emotion around these decisions, of course, right? And so we want to diffuse that and look at facts, and that's where tools can be helpful to look at facts of a case. And it really is there to help assist on deciding what we should do, why we should do it, how we should do it. And it can be used for clinical and non-clinical decisions. But remember, this is only a tool. It cannot make the decision for you. And so we have to build capacity in using these tools and using them appropriately, right? A hammer is great for a carpenter. They can build anything, including, buildings and homes. A hammer in my hands is not as useful. So we want to make sure we build capacity on how to use these tools. So what I'm introducing today is the idea tool for ethical decision making. Many of you may already know about this tool. It's been in community and hospital settings for many years. Colleagues at the Joint Center for Bioethics and at CCAC, the former CCAC of Toronto, helped really developed this tool, and people have been using it in community, in hospital for many years now. So it's not a new tool. There are other ethical decision-making tools which are just as useful, and they can also be found free of charge on the internet. And they have different number of steps, but essentially they're all very similar in that what you want to do is step one is identify the facts of the case. What are we talking about here? That's to help remove emotion. It also helps to understand what are we missing? Are there things that we're missing, questions that we should be asking that we don't have answers to? It helps to assess who the appropriate stakeholders are for this decision, right? Who else should be at the table to discuss this? Are we missing individuals that would be appropriate and helpful? Step two is determining the ethical principles in conflict. So what do we want to do, in the case of Dave, and we'll go through this now step by step with the case of Dave in mind, but you'll see that we really want to try to balance his autonomous decision-making with also his safety, right? We want to make sure that he's getting the care he needs. And then step three is really exploring all options. And that's why when we have more people at the table, we come up with more creative solutions that can bring the conflicting principles as close together as possible. And then we could, decide to then act on what that decision is and evaluate as we go. Is it working out? Is it not working out? Right. And in this case, we will really be focused on, should we be reporting this situation? Should we not be reporting this situation? What else could we do? Right. So thinking about that as well. So if we think about Dave, for instance, we have the medical indications. We'll do a 4-box method that's used in this approach. And so we have the medical indications, we have contextual features of the case that we want to consider. And as you can see, we're starting to ask questions in here as well. I want you to be less concerned about which box things should go in. It's more so about, do we have all the information in one place that we can see it and analyze it effectively, right? So don't get caught up in the right box. It's more so, what should we be considering? What questions could we be asking in order to unpack this case a bit further? That helps us lead to deciding, should we be reporting? Should we be doing something else? What else can we be doing? So considering those as well, right? We're really looking at facts of the case as much as possible. And when we don't know a fact, we're asking a question, right? And so that those questions can be in there as well to get us to the next step, which is thinking about, what are the ethical principles and conflicts? In this stage, we think about, if you're providing services in community or in hospital, and long-term care facilities, retirement homes, wherever that is, we want to ensure that we don't impose our value system on others. We also have to think about, do some self-reflection on what are our values and are they influencing our decision at this point? What do we think about that? We may even consider the values of the organization that we work for. And what we want to ensure we're doing is maintain the values of the client. So that older adult at the center, so that we actually know what they're thinking, why, and how we can work through this. At this point, we may also be considering, is this an ethical dilemma, right? It's not always clear if we're dealing with an ethics dilemma. So that's where these tools are also good in unpacking, is this a values conflict? What are we looking at here? What do we need to explore? And it's, this may be a communication issue. Maybe we don't truly understand what Dave needs and what he wants and what his definition, like if there is abuse or neglect that we should be considering. And so we need to, it's a good opportunity with the tool to open the lines of communication so that we can hear and understand one another, right? We have to understand, is this like a legal abuse issue? And that will help us get to whether or not to report, right? And as we're exploring options to bring values closer together, we suggest writing down on this sheet, and I've only put down a few just as an example, put down everything, the good, the bad, and the ugly, right? So we say like the polarizing choices, which in this case, would be maybe leave him at home and we don't think that this is a reportable offense. It might be then another polarizing choice might be move him out immediately and report immediately. And we see strengths and weaknesses of each of those, but there may be an option in between once we understand if this is an abuse situation, right? And that's what we want to explore, is the whole situation, thinking about, is there abuse happening and therefore should we report? Are there other options or support systems that could also be implemented? Are there safety plans that could be developed to support Dave's autonomy, but also with safety at the same time? And then you're going to act on either one of those choices or a variety of options. You might be putting things together and see how it goes. Evaluate as you go, and you may get more information. When we think about values-based practice, we're really talking about an approach or a process that focuses on the unique values of the particular individual, so the older adult involved, and using those values along with evidence to decide on where to go next and what to do next. And so as we all age, this happens to all of us over a lifetime, our needs change, and this can lead to instances of abuse, and sometimes very unintentionally. So if we think of our own experiences within maybe our own families, changing health and medical care can cause stresses, progressive dementias, other memory impairments, caregiving, being an adult child and having your own younger family potentially, and your older parents to care for now. Financial issues of the older adult and how that may influence stresses in their lives and the lives of caregivers. Housing issues or living arrangements, all of those can be stressors to the entire family unit. So we want to think about having values-based conversations as early as possible, right? To understand where the stressors are, what the needs are. And that's where elder or intergenerational mediation can help facilitate some of those and addressing some of those changes and stresses and having these constructive conversations, maybe making decisions earlier on. Right, some of these benefits that we want to think about are, it can actually help prevent some conflict earlier on, because really what we want to do is resolve some disputes earlier so they don't actually affect the relationship of the family unit. So it offers these opportunities for the older adult and other concerned parties to come together to have some mutual understanding of these concerns and the older adult's values. Right? It can also, what we want to do is provide a non-adversarial model of communication with an approach to future discussions, thinking about what could happen. It's really a means of providing effective conflict resolution during stressful situations, and the early application. Really, what we want to do is hopefully improve, preserve, and maybe even restore some of these relationships, so that what we want to do is prevent the instances of potentially something escalating into abuse. So this is more of that upstream approach, right? So when we think about this, what we want to do is work as much as we can with that older adult in their family to think about some of these plans. And so I see we're getting close to time. And so what I want to do is just quickly poll all of you again, just a very easy, quick one, and just say how many of you have completed a will? Just yes or no, really quickly, if you want to answer. And I'm going somewhere with this because we'll get to our last piece of the presentation.
They're quick this time, so we're getting lots of response. Yeah, we're getting lots of responses.
This one's an easier one. Yes or no? Some of us have done it, some of us haven't.
Just give it a couple seconds.
Sure.
It's almost 50-50, actually. I'm just going to end the poll.
Great. And what do we have? Oh, look at that. Look, it's like pretty much an even split. This is really interesting. Right? 51% said yes and 49 no. So we're kind of right in the middle there. Thanks for doing that. And I am going somewhere with this because what we want to encourage as well as a way to mitigate potential elder abuse is to alleviate some of these stresses as early as possible. So we plan for lots of life events. We pretty much plan for everything, even our vacations, right? We do birthing plans when we hear we're pregnant. Maybe financial planning happens throughout a lifetime. We plan for our retirement, right? And so we have to think of planning for aging. And this is to ensure that we receive the quality of life that we feel is acceptable to us. We have to think about these things so we develop the best plan that we possibly can in advance. And it includes many things. And again, just like the idea tool for ethical decision making, there is a lot of tools to help support aging plans that are free. The government of Ontario has one. There's lots of great ones. And what they're to do is to think about your health, your relationships, like who you want to not only be your attorneys for personal care and finance, but who you trust, how that's going to look, what stresses they can actually, you feel that they could support and what they couldn't, what your home life is going to look like. Do you live on a 1 level or 2 level home? Do you think you can stay at home? How about if you couldn't get in and out anymore? What does that mean? Or your transportation, if you can't drive your car anymore, are you the type that would take taxis or Uber, or do you need a different means of transportation? Are you going to be relying on family? Could that be a potential stressor, right? Finances, safety. What do you think if you start falling in your home? What does that mean to you, right? What other support services can you think about now that may be able to help in the future? And the community around you, are you part of community groups that are very helpful? Are you part of religious groups or cultural groups? And thinking about you and your partner, if that's applicable, right? To think now for the future and start some of those conversations early as a means to potentially alleviate some of those stressors and opportunities for abuse. So I'm just going to pull you one more time before we wrap up, because I'm just curious to see how many of you have completed an aging plan. So 50% have completed a will, and I'm curious how many of you have completed an aging plan to end off our session today. How's it looking, Ryan? Are we almost?
This is interesting. So I think we've got over 100 people responded.
Oh, wow. Great.
I'm just going to stop the poll.
Great. Okay. So we have 89% who said no and 11% who said yes. You know what? That's completely normal. And I'm really impressed by the 11%. Many of us don't do this, but it's a good opportunity to think about it. And like I said, there's a lot of tools and resources to help support that. There's a lot of people. I help develop aging plans and do intergenerational mediation, but there's a lot of also free tools that you can use to support that as well. So I want to thank you all today, and I really would like to open up the floor to discussion, questions, comments, feedback, and hear from all of you.
Great. Thank you so much for that informative presentation. I think after, what I'll do is ask Rosanna for the link for that framework that we can post after on our website. I know there's different programs. I was trying to search for it online, but that we can share that with people so they have that tool after the conference that they can use maybe in their own work, the worksheets that you showed, that might be helpful for people as well. So there's a couple questions that people are just starting to come on in now. So is a patient or resident at the table when the ideas tool is used, along the lines of nothing about them without them?
Yeah, and that's a great question. So it depends where you are and what environment you work in, but ideally the patient would be involved in that if they're capable of being there, right? So, and like I said, so in teams, it depends on the setting, but really we want to ensure that the values of the individual are expressed. Definitely during intergenerational mediation, it's always important to have the voice of the older adult and their values respected.
And I think that's often missed, right? We talk around the person, but we don't include them. And then we present this solution to them that doesn't even align with what their own values and beliefs are. So then they say, no, I'm not doing that. Well, maybe if you have included them in that process, then you might come to some better resolution, as you just mentioned. So that's a good question. Somebody's just saying, which aging tool are you is there an aging planning tool that you're recommending online?
So there's not one in particular I'm recommending online, but the government of Canada does have their own. And I could put in a link for that. I'm not trying to advertise for anyone, but it is a great free tool, a great free resource that anyone in Canada can use. So I can share that. And that's I'm not talking about necessarily advanced care planning. That's more health related. I'm talking about comprehensive aging plans. So kind of looking at everything, not just health.
So there's just a sort of a comment question. There are situations where all the collected information and investigations point out abuse is happening. Older adults don't want to report it. I wonder if I check if I understood right. In such cases, workers respect the older adult's decision as long as they are capable, informed, and voluntary.
It's also, okay, so that's the thing. It's working with the individual. The more you unpack with an individual and what their fears are of reporting, the more information you'll get, right? And there is more solutions. So that's what I'm suggesting, is that I have never encountered a situation where we don't unpack further, where we can't come up with a resolution that keeps the individual safe. Right. And that's where even safety plans, all those pieces come into play. And I've worked with so many amazing professionals. I've been very lucky over the past 20 years to work with great teams where I've learned so much from people, that there is an opportunity that as we unpack and understand the fears of the older adult, there's great implementation plans that can be suggested that, in my experience, not every experience, that has been appropriate for them, and they've agreed to proceed in that way.
I think that's so true, is that the unknown of what's going to happen if I do report, and who's going to be there for me. If it's my son or my daughter, then what happens? And, so eliminating that, knowing there's support there for that person. You talked about safety planning. There's a number of things that we can do to help guide that person along. But yeah, like you say, there's that balance, right, of autonomy and risk, depending on what that level of risk is for that individual kind of thing too, right? So that's a good response for that. The next question.
And sorry, and I just wanted to share, and knowing that we can reach out to each other, right? Like Elder Abuse Prevention Ontario, Advocacy Center for the Elderly. Like there's so many great community organizations, like so many that I can't even list them all, that we can ask for advice and support, and there's resources. So feel free to reach out to colleagues everywhere. I've never had anyone not be helpful and supportive.
So there's just sort of a question about some clarification from some presentations. It says, I'm a bit confused about one session. A presenter stated that once you report elder abuse, the person can be charged even if they don't want to take it that far. However, another presenter at a session seemed to say that the older person doesn't want to take it that far, then that can't happen. Can anyone control the outcome if the older person doesn't want to have their family member charged? I'm thinking the first one is around a domestic issue.
Yeah, and I'm really sorry. I think that's a legal question. I wonder if there's any of our lawyers who are participating right now that maybe in the chat can help with that, because I don't provide any legal advice.
Right. Yeah, I think that's kind of depending on the circumstances and the situation of what was being talked in those contexts. And I unfortunately didn't get to attend all the sessions because I was moderating. So we can go back and maybe look at that and see if we can answer that on our website after for people.
Yeah, that would be great. And that's helpful for all of us. So thanks for asking that question.
The other one, just again, back to hospital. Do you need consent to report hospital if the information, like to forward to anybody in the hospital? Do you need consent to do that? I'm thinking as a staff person. Or do you need consent from the senior to report that to a team? Or do you just go and talk to the team directly?
Well, if they're part of the circle of care. So for instance, the social worker is the social worker for that individual. So even though it's maybe the nurse, the bedside nurse who's suspecting the elder abuse, there's still the physician, the social worker, we're part of their circle of care. Bioethicists or practicing healthcare ethicists, our legal department, our risk department, there's clinical practice leads, like those would all be supportive roles to the individual. So the question can be asked, right? Then we become part of their circle of care to help support them and the best care that the organization can possibly provide.
Right. And I think just getting back to that previous question, I was saying that if there's a situation where it's a domestic, let's say that case scenario you're giving about Dave, and the police were called and it's an intimate partner violence because they're a couple, then the police have a protocol that the charge would happen. I think one of our officers just indicated that as well. So that wouldn't give a person the choice to say, yes, I want him charged or not because of the mandated protocols they have. So maybe that's would clarify that for people. But as you say, those are serious kind of circumstances. Does anybody else have any other sort of questions related to the ethical kind of issues? I know that these are complicated cases and for many people, so I appreciate your input, and especially, just dealing with the complexities in all different settings in terms of long-term care, retirement, and community, supporting the older adults. It's a dilemma. And I think what you said, Rosanna, is, supporting each other and having that outreach to each other, because it's hard to sort of sit with it yourself. And if you can talk to other people and have that collaboration, I think that's, and everyone's, it helps everybody sort of, you have the support, but also you're helping the senior in the long run as well.
Thank you.
Great.
These situations are so complex, so I appreciate the time and space to discuss them all with you, and thank you so much.
Great. Thank you so much, Rosanna, for taking the time to share your expertise with us. I did put your website in the chat box for people to go to your website to see other supports and information that you provide as well. So maybe people will have a chance after the session. We'll post that on the website under the session with the PowerPoint and recording for people to access that information. So thank you all. I'm going to move into start closing remarks so we don't have to change sessions. And I'm just going to share my screen. So we are in conference mode. So I just want to let people know that we are hosting another conference at the end of the month. And it is on gender-based violence, inclusive voices, and collective power. So we are collaborating with the Canadian Network for the Prevention of Elder Abuse, as well as Women Act, to host this event. We have national partners who are going to be presenting. Again, we'll be using the FeedLoop platform. So again, we are not charging for the registration, but we do appreciate you registering ahead of time, just to give us ideas of numbers, so we make sure that you're in and you're registered. I want to thank my IT support, Irina, today, for our staff. If you have any questions about registering for any of our events, please reach out to her. Again, this will be on FeedLoop. It's on our website, and we'll be getting further promotion about that event. And the other upcoming training that we have kind of leads into the one we just did around ethical decision making, is sort of having the knowledge to assess risk of harm. How do I know that someone is at risk? It's mostly we're looking at this training we did previously. We did 2 sessions previously in the spring, and we've had some requests to do it again. So there's a HOPE tool, it's harm of older persons tool, evaluation tool. You come out knowing, having this training and certificate to use the tool, assessment of risk for the older adult as well as the perpetrator, and developing intervention plans, looking at options and resources, things that you might not have thought about in terms of resolutions. So that is on December 12th, 13th, and 15th. They're half-day sessions. And the registration fee, there is a facilitator fee and cost for manual production and mailing. So it's $199. And we do limit attendance to 40 because it's an open workshop, breakout rooms, etc., that we do engage in lots of discussion through that workshop. So just letting people know that that's available. And just lastly, if you have your phones handy, we really do appreciate your feedback on our conference today. Any suggestions, please share with us. We'll send this out also in an email if you don't have a chance to finish it today. Just giving us options with things that we could improve on and topics for future discussions. We do appreciate that you take time for that. And just indicating that, we are doing things beyond conferences and education that do require other supports in terms of donations. That does help. So these, I think all of our nonprofits have a reach out and Giving Tuesdays coming up. So we thought we'd just put this in as well. Every little bit helps in terms of the work that we do to help protect seniors in our community. And lastly, if you have any questions about today or want to reach out to us for specific training, please reach out to myself or any of our team members on our website to ask or request some training and education. Or if you have questions about today, we are more than happy to have discussions with you. We do appreciate your engagement. I know it was a long day, but I think there was a wealth of knowledge that was shared today. And we will be posting the presentations that were recorded on our website early next week that will be available for people to review and download. And so you'll have that material available. Lastly, I do want to thank not only everyone who took the time out of their busy schedules to attend, but also to our ASL interpreters. We have a huge team of supporters. They've had a long day of work, and just making this accessible for everyone, I think, is so important. And we continue to host our events with ASL support to make sure that everyone gets this important education information. And we have lots of nice comments coming back from everyone, so we do appreciate that as well. And sorry, I was just looking at the chat box. So finally, I just want to say that there was some excellent discussions through all the presentations, from the keynote to the final presentation. I think we covered all the areas of reporting that, you know, from the mandatory reporting in long-term care and retirement homes to our community, and looking at our support through the legal system and our police partners and the work that they're doing to help protect seniors and their safety and well-being checks, as well as our Office of the Public Guardian Trustee and the roles that they play. I do want to thank all the speakers today. So I'm going to close it out for our conference. I hope that you will join us for our next event on gender-based violence. We do unfortunately see more older adults experiencing gender-based violence, and we need to have that conversation and continue that conversation, as older women particularly are not talked about in this manner, and we know that that's something that we need to pay more attention to. So thank you all, and I'm going to stop my screen and have a good day, and thank you again for all attending.